Good afternoon. I'm Annie Naylor, and I'm with Arizona Center for Muscle Therapy. And you can find me at my website at arizonamuscletherapy.com. And you can go to my YouTube page where I am with LinkedIn and with Facebook. And I'm back again to talk a little bit more about pelvic floor pain. We want to kind of go through the stretches that I have taught Rachel and her partner Jay to do with each other to help her as far as dealing with this issue that tends to flare up from time to time. Pelvic floor pain is, people will say, well, where does pelvic floor pain come from? It could be any number of things that could be causing it. But one thing that we do know is that there are a tremendous amount of trigger points in the muscle that are involved that feed into the attachment site. And so what we want to do is we want to work with those muscles as much as possible. So I'm kind of taking Rachel through some of the stretches that she does every evening. And one of them is I like to get into the hamstrings. I do like to traction that leg a little bit. And what I'm going to be doing is I'm going to be doing a little bit of what's called dynamic stretching. Okay, so I'm going to be protecting, and I feel like I'm taking her through the stretch, and then I'm going to release it. And then I'm going to take her through the stretch, and then I'm going to release it. Now I'm going to bring that knee out because I want to get into the adductor region. This is tremendous, and for all of you women out there that are thinking of having babies, all these stretches are very, very important to do. I'm going to push down on that knee while I'm taking my leg at the same time, and I'm going to be stretching that leg up forward. I'm also going to take that knee and I'm going to straighten it to take it all through its range of motion. And then with this leg, but I'm going to do it on this side, is I'm going to hold here at the shoulder, and I'm going to take that low back through a nice long stretch. Okay. And then one other stretch that I really like to do for pelvic floor pain is I would like to have Rachel come all the way over. She's got to hit my leg right here. She's going to keep this knee bent because she wants to protect her lumbar spine. This is a psoas stretch, okay, that big, big, deep muscle that's in the groin. So I'm going to take her above the knee. I'm going to isolate that hip, and I'm going to take her through this stretch. And now she's really hanging herself off the side of that table, so it's good to have a partner to do this stretch with. But if you can't, you can do it on your own. I teach people how to do it by themselves. They can just let the weight of the leg just lay off to the side of the table. And then what you want to do is you want to pick that leg up and you want to scoop them back into the center of the table. So you want to protect the patient all the time at doing those types of things. And that's basically for the pelvic region what we would do as far as stretches with pelvic floor pain.
And the reason you told me that you stretch and release because muscles expand and contract naturally?
Yeah, that muscle only does two things, is it expands and contracts. And so what we want to do is when we're working with muscle that's having trigger points and doesn't want to go through full range of motion, we want to dynamically stretch that muscle until it starts to learn what its job is, which is to expand and contract. I don't want to put it through a sustained stretch because it might irritate the muscle. So once you're going through full range of motion, certainly you can go through into a sustained stretch.
Yeah.
But as you're working with me and I am taking the trigger points out of the muscle, I like my movements to be dynamic.
And that's helpful for me. That was helpful for me when you told me that because I do yoga. And it's all about getting into the deep stretch, but when you're healing something, you were telling me it's part of retraining the muscle too. So expanding and contracting has helped me personally. And I noticed there was a difference between even my yoga practice once I started doing the rehabilitation that you were showing me.
Right, right. So that's the whole thing, is we don't want to put the cart before the horse. We want to get these muscles to understand what their function is, expansion and contraction. Once they can do that, of course, then we can take it to its next level. But when the muscle is in pain, that's a mechanism that's telling us that there's an issue and that we need to pay attention to that issue. So, thank you.
Thanks.